Welcome to aminacademy.com. In psychological abnormality, let us discuss who is psycho or psychopathy. The word psychopathy or psycho was first used in the late 1800s to refer to people with some mental health conditions. The term comes from two Greek words that combined means suffering soul. These days, psychopathy is not a widely accepted clinical term or diagnosis, but people may still commonly use it to refer to antisocial personality disorder, ASPD. And while some clinicals still use the term psychopathy to refer to a severe subtype of ASPD. What is antisocial personality disorder? ASPD is a pattern of unconcern or disinterest in the right and needs of others, often paired with a tendency for impulsivity and lack of remorse. It has also been called psychopathy and sociopathy. A personality disorder is a lifelong mental health condition that affects how you behave and feel about others and yourself, often causing a high degree of distress or impairment. It may affect aspects of your life, like the way you think, how you feel, and how you interact with others, and your ability to control your impulses. Unlike others, personality disorders, only people over the age of 18 years can receive a diagnosis of ASPD, although symptoms often develop earlier than that. Now, some symptoms of psycho or psychopathy: behavior that often with social norms, particularly not following laws and regulations, disregarding or violating the right and feelings of others, difficulty feeling remorse of empathy, or justifying actions that have hurt others, tendency to lie, manipulate, and deceive others, often for personal enjoyment or gain, general disregard for the safety of self and others, avoidance of responsibility, including work and financial commitments, aggressive and violent behavior and constant irritability, difficulty planning ahead or managing impulses. These symptoms must be evident across different situations and over time, and they are often evident since adolescence, although a diagnosis can only confirmed after age 18. Now we'll discuss further about who is psycho. Psychological abnormality refers to a deviation from normal functioning that causes significant distress or impairment of in a person's life, often involving disturbed thoughts, feelings, or behaviors. The term psycho does not refer to a specific person with a psychological abnormality, but is more broadly associated with psychology and the study of the mind. Though it can also refer to the term psychopathy, a disorder characterized by traits like lack of empathy and antisocial behavior. What is psychological abnormality? Psychological abnormality or a psychological disorder is generally defined by a combination of characteristics. First, deviance, behaviors, thought, and emotions that are different from what is typical or expected within a specific cultural context. Distress, a person experiences significant inner turmoil or suffering due to their thoughts, feelings, or behaviors. Dysfunction or disability, the abnormal thoughts, feelings, or behaviors significantly impair the person's ability to function effectively in daily life, such as in work, relationships, or self care. Danger. In some cases, the abnormality can also be dangerous to the persons or others. Who is psycho? Psycho is not universally recognized individual with a psychological disorder. It is a shortened term that can evoke different meanings, often in a colloquial way. It may be an informal reference to psychopathy, a personality construct that involves a pattern of antisocial behavior, lack of empathy, and egocentric traits. In popular culture, the term psycho has been used to describe characters with severe mental illnesses, sometimes to the point of stigma. Some key points. Psychological abnormality is a complex and has no single universally accepted definitions. It is defined by multiple factors and is assessed through a framework like the Diagnostic and Statistical Manual of Mental Disorder (DSM). It's important to distinguish between informal uses of psycho and the clinical definitions of a psychological disorder. Some psychotreatment. Psychotreatment is typically refers to the psychopathy, psychotherapy, or psychological treatment, which involves a trained mental health professional using talk therapy and other techniques to help individuals manage mental health conditions, stressful life events, or problematic thoughts and behaviors. Common types of psychotherapy include cognitive behavioral therapy (CBT), psychodynamic therapy, and dialectical behavior therapy (DBT). So far, we discussed about who is psycho and psychopathy. We have done. Please subscribe our YouTube channel.